Welcome to the King's Podcast Season 2. My name's Danielle and I'm here with my co-host Manasa.
Today's episode is dedicated to Men's Health Month and we're here today with Dr. Ali Razzak. Hi Doctor, please can you introduce yourself for the viewers?
I'm Dr. Ali Razzak. I'm a consultant in family medicine and medical director based at King's College Hospital Marina Medical Centre in Dubai Marina.
It's Men's Health Month this month, commonly known as Movember. Will you be growing the moustache out a bit longer this month, or what's your plans?
Yeah, it's a very good question. I am considering it. Obviously, I've got my beard already that I'm sporting, but I think for Movember, I might just have to grow the mo, as it's commonly known as, but let's see.
Nice. Let's see how long you can get it by the end of the month.
Absolutely.
So, because it's Men's Health Month, let's get right into it. Men seek out help much less than women do. Is this something that you see in your practice?
So to answer that question, absolutely yes. We know from many studies that men are much less likely, in fact, half as likely to go and see a doctor for a medical condition than women. There are a number of reasons for this behavior. Now, one of the main reasons is really, it comes down to these kind of notions of masculinity. So men typically have this sort of macho bravado kind of approach to most things in life, and this translates into healthcare as well. You know, they'll want to not see a doctor because they may think of it as a sign of weakness. They may just want to deal with the problem themselves. A lot of men also have a fear of the underlying diagnosis. So at least 20% of men actually avoid seeing their doctor because they're worried that there is actually something quite seriously wrong with them, which doesn't actually make much sense. If people do feel that there is something wrong, the worst thing that they can do is actually to not do anything about it. And then you've also got men who men generally don't like to be examined, particularly when it comes to sort of intimate, private examinations. There is certainly a reluctance when it comes to this. And again, it goes back to sort of notions of masculinity.
Drawing on from that, as healthcare providers, what can we do to encourage men to seek that help, especially in terms of prevention?
Having events like this, talking about the issues that specifically affect men. So, for example, for Movember, it's all about raising awareness of men's physical and mental health. When it comes to physical health, it's about talking about conditions like, prostate cancer, testicular cancer, men's mental health as well. But really, it's about all of us, even our loved ones, the wives, girlfriends, daughters. If you are concerned about your man, then do speak to him, to encourage him to do that, because evidence does show that nagging somebody to actually go and see their doctor does actually work. So there is some evidence that shows that that's the case. But it's all about normalizing and talking about these issues that affect men specifically in a more natural way, so that there's less stigma when it comes to seeing a doctor and getting those things checked out for men.
Okay, so nagging is good. I remember that.
Yeah, giving you permission to nag your husband.
So men are more likely to suffer from physical health problems such as diabetes and stroke and prostate cancer compared to women. So why do we think that is?
So there's definitely physiological differences between men and women. So when it comes to the biggest killers or the highest causes of mortality for men, which is cardiovascular disease, we know that, for example, women, estrogen is a protective factor against cardiovascular disease in premenopausal populations. After the menopause, then the risk starts to increase for women as well. So that kind of protective effect starts to become downplayed. But actually, that doesn't explain really the differences between the two sexes. There are several major risk factors associated with things like cardiovascular disease. So they include things like, having high blood pressure, having high cholesterol, diabetes, a poor lifestyle, which may include, lack of activity, stress and smoking. And these things tend to be a lot more prevalent in men than they are in women. For a lot of these different reasons, they combine together to form a perfect storm where, men become much more at risk of developing these sorts of things than their female counterparts, unfortunately.
That's really interesting. A thing that we see quite a lot about, and we were quite keen to ask you, is especially on social media, we see a lot of this kind of talk about testosterone or TRT, and people like Joe Rogan have obviously gone publicly and kind of promoted it or whatnot. How do we encourage people to check their testosterone levels, and how do we let men know that they can overdo it or underdo it, or what's the general consensus of it?
So, testosterone is a very important hormone. It's the main masculine hormone, and it's responsible for men, having the masculine traits like having increased muscle mass, having increased sort of libido, being ambitious, being full of energy, facial hair, body hair, all these sorts of things. So when it comes to sort of when to tell men to get their testosterone levels checked, well, typically after the age of about 30, men's testosterone levels start to decline by about 1% every year. It could be at a faster rate depending on sort of other comorbidities as well. So really, if you're a man above 30 who is starting to notice that some of the things associated with having low testosterone are what you feel. So if you feel very fatigued, if you feel that your libido is not where it used to be, if you just feel that your motivation and your energy levels are quite low, then certainly at that point you should be considering having your bloods checked, including your testosterone levels. Now, what is the risk associated with treating low testosterone? Well, if it's done in a proper way, if people come and see their doctor, whether it's a family medicine doctor, if they find that they have low testosterone and they end up get referred to someone like an endocrinologist, a hormone specialist, that if it's done in the proper way, where they're given the right amount of testosterone, then typically, a lot of the risks can be mitigated. However, the risks really become more apparent when people start to maybe, use steroids in a non sort of structured way under the, without anyone giving them any clear advice. So some of the risks associated with that can be things like having, poor fertility. So, if you can imagine people who take testosterone injections, what happens with that is that, the body or the brain senses that you've got very high levels of testosterone, and because they've got very high levels, then the body starts to make much less testosterone itself, to the point where it may start making no testosterone at all, and that will affect someone's fertility. It can also affect very high levels of testosterone can increase the risk of cardiovascular risk, having heart attacks, having strokes, having blood clots as well, acne. So there are a number of, and also importantly for older men, so men who may have prostatic problems, so enlarged prostate or even prostate cancer, if they take testosterone in a non sort of medical way, a non-monitored way, it can actually lead to the progression of prostate cancer and prostate disease as well. So the message really is that if you're concerned about low testosterone, then do see your doctor and get it checked in a proper, structured medical way.
It's so important to talk about mental health, and it's something that a lot of men don't talk about. Why do you think that is? And also, what mental health issues do you see men in Dubai coming to you with?
Again, it's mental health in men is something that's really not talked about anywhere near as much as it should be. So, again, it comes down to these notions of masculinity. So men may think of mental health even more so than physical health as a taboo subject or a stigmatized thing. And if you have a mood issue, if you feel depressed or low, this is something that you should be ashamed of even. So, there is a lot of this kind of feeling around it when it comes to mental health. The types of conditions that affect men from a mental health point of view are things that we see are, depression, low mood, anxiety, stress, sometimes also sort of, substance and alcohol abuse potentially as well, loneliness as well. All these things can contribute to people's sort of declining mental health. Of course, there are other sort of more, other conditions such as bipolar affective disorder, schizophrenia, but this tends to be seen by psychiatrists. But certainly there's evidence that shows that at least 1 in 5 men at some point in their lives will have some sort of mental health type problem. And the very sad statistic is that, that's come from the Movember charities, that of every minute of every day, a man will take his own life due to depression. Men are account for 3/4 of suicides, unfortunately. So it's really important that men, understand that there are very serious mental health issues that can affect them, and that they should seek help when they do feel things aren't 100%.
Absolutely. Do you think, relating that to kind of like Dubai lifestyle, do you think this kind of all work mentality is kind of leading to these factors of stress, depression, loneliness, or like what do you think that we can do as a society in Dubai to kind of mitigate this a little bit more?
Dubai is certainly a city where people, come here who are very motivated, and, they want to work hard and make the very best sort of lives for themselves that they can. And there's a lot of pressure to perform, and there's a lot of pressure to sort of look a certain way, to, have the right sort of car and the right clothes and be seen in the right places. So all these things will lead to, you know, a lot of pressure on people to perform and to have that kind of lifestyle, or to at least appear to have that sort of lifestyle. So I think it's really important for anybody really to kind of sometimes just take a step back, and, you know, if they're waking up and they're working really hard just to maintain appearances, then that's not really a reason for them to sort of to do these things. And if they feel that things aren't quite right, then, you know, at that point they need to really ask themselves that, you know, how much is this sort of modern, fast-paced lifestyle affecting your mental health? And is it time for you to slow down? And it's really important as well with, you know, when it comes to social media as well, to sort of take a break. And a lot of these things don't appear, you know, the things that they appear, they're not quite the same as reality. So people, men in particular, need to take these things with a pinch of salt.
Related to that, on social media, like you were saying, a lot of people do promote this hyper productivity and wake up at 5 a.m. and just on the go all the time. And how do you think that's negatively impacting men?
Look, I think there's no harm in somebody working as hard as they can to you know, to be the very best version of themselves that they can be by working hard. You know, as long as, you know, waking up very early in the morning, it's not necessarily a bad thing, but, you know, provided that person is getting their adequate amount of sleep, so they're getting the 7-8 hours of sleep. You know, they're looking after their physical health, they're looking after their mental health. So it's all a careful balancing act. You know, of course, people will push themselves extremely hard, but as long as they are looking at every single aspect of their life, and they're just not purely obsessed with, you know, work and sort of their finances and you know, keeping up appearances, as long as they're doing the right things for their own mental and physical health, then I'm a supporter of that.
Circling it back, but also linking it to the point about social media, body dysmorphia in men isn't something that we talk about either. So we don't really talk about mental health in men as much as we should, and I don't think we talk about body dysmorphia in men as much as we should either. But when you look at social media, men are kind of bombarded by this imagery of the six-pack, the biceps, this, I don't know, sleeves, this really specific look. How can self-esteem be affected by this? And is this an issue that you hear men talk about quite a lot, or is it more just something that's kind of spoken about on like TikTok or Instagram?
Body dysmorphia syndrome or disease in men is actually a very prevalent condition. In the last 25 years, for example, it's tripled in incidence amongst men. So it actually, you know, recent study shows that it affects 43% of men. And that's almost as many as much as it affects women. So there's definitely, you know, an impact on this on men. You know, when it comes to body dysmorphia, it's basically where people may become unhealthily obsessed or fixated with an aspect of their physicality, whether it's their face, their nose, their skin, their body shape or muscles, in an unnatural and an unhealthy way. You know, you mentioned this issue regarding sort of people trying to look very fit and muscular. There's a very specific subset of or a condition called muscle dysmorphia, or bigorexia, as it's more commonly known as, and it affects specifically men who actually work out obsessively. And when you actually look at these chaps, they tend to be very muscular, much more muscular than the average person. But in their minds, when they look in the mirror, you know, what they see is a small, skinny person or an overweight person. And although it might sound trivial, but this can really affect their mental health in a big way, and it can lead to depression, being housebound and all sorts of things like this. So it really is important that people sort of take on board that the images that they're flashed in front of them all the time through social media. And we live in a very visual age at the moment, unfortunately, you know, although there may be some benefits to that, but also, you know, some of the negative aspects, you know, manifest in things like body dysmorphia syndrome. And, you know, all I'd say is, you know, looking a certain way may not necessarily, you know, accurately reflect somebody's actual underlying health. So the most important thing is to be healthy, you know, both from a physical and mental point of view, you know, and not have to conform to look to a specific way just because it's in fashion at the moment.
Thank you for talking to us so far about the physical and mental health of men. We like to end the podcast with a top secret though. So with it being Men's Health Month, what's your top secret for men to look after their health?
I mean, what I would say is this, that, you know, be the very best version of yourself that you can be. But when you try and do that, make sure that you're, you know, for you to be able to do that, you need to be at your 100% when it comes to both your physical and mental health. So, you know, don't push yourself into the ground, you know, don't work yourself to the bone. But if you're going to work hard, make sure that you've got, you know, that the health capacity and ability to do that. So, You know, it's Movember, it's men's sort of a health month. You know, put yourself first, get yourself checked out. You know, you find out that everything is okay, that you're healthy, that there's nothing really untoward. And a lot of the conditions that can affect men, that cause them problems down the line, are things that are very preventable, that are very easily checked for. Potentially you could save your life by getting yourself checked out.
Amazing. Thank you very much, Dr. Ali. Thank you.
Thank you for having me.
Thank you for watching this episode of the podcast. Dr. Ali brought up some really emotional and insightful topics. Here at King's, men's health is really important to us, and for the duration of the month, we will be offering 10% off on all of our health check packages.